and I think that's the main reason why you get into the medical field, right? I'm a physiotherapist, so I get to see a lot of people with a lot of pain
Mhm.
daily, and so I know that there are some times that some people, if they do a diet that is a bit more towards leaning towards the meat side, that
Mm.
they would feel a lot better. And I tend to, not with all of them, but with some of them, when we get to talk, and I'm a bit curious to see what is their lifestyle. Why do they have all these chronic pains? And
Mm.
usually, when we go into the diet, basically it's like, no, meat I avoid. I avoid meat, and
Mm.
it's very interesting because I have never seen. Um, well, of course, carnivore people, we are not a lot in this planet, so it's not like you go out and you see a lot of people doing what we do, but I have yet to see a person that is, you know, have all these chronic pains and eats meat every day.
When you're talking about not seeing a lot of carnivore people in your physiotherapy clinic, um, and there aren't very many of us. I have friends that are doctors and GPs, and I have a lot of patients that are carnivore. They're extremely healthy. They come in for a checkup every now and then, and everything's good. And you get a stamp of approval, and they go off. And a friend of mine here is a GP. He has well over 200 carnivore patients, and he says these are the ones that come in once a year for a checkup. Everything's fine. They're on no medications. They've come off all their medications, and they go home, and they're just healthy, and they just exist. They're not coming to, it's all the other people that eat an omnivorous diet or a vegetarian diet. Those are the ones that are coming in with all the illnesses and problems and medications that need adjusting or additions. So, yeah, it's growing, but we have a lot of these examples of these people being very, very healthy.